Hello, everyone. Can you hear me okay? Oh, it's so nice to have such a big group. Just want to introduce myself. My name is Dr. April Phillips, and I am the clinical director of the Psychiatric Mental Health Nurse Practitioner program here at Frontier Nursing University. We have several of our faculty and staff here today. I'm going to go ahead and just ask that you briefly introduce yourself if you don't mind. Shall we start with, hi, Jamie.
Yes, hi, my name is Jamie and I am one of our clinical advisors here and I live in Lexington, so about 15 minutes away from the campus. And I would be meeting you at Frontier Bound to talk about clinical sites and that process.
Hi, everyone. I'm Dr. Kevin Scalf. I'm the department chair for the Psychiatric Mental Health Nurse Practitioner program here at Frontier. I live in Kentucky, so I'm in the home state of Frontier. It's nice to see everyone out this evening, and I look forward to a good discussion.
Well, we will go ahead and get started. And we've done our introductions. If you could please go to the next slide, Rosalie. So just want to talk a little bit about the mission of Frontier. Frontier has a long-standing history and legacy for the provision of services to underserved populations and people in need. And it was first founded by Mary Breckinridge specifically to address the needs of the rural populations of Kentucky. So our mission is to provide accessible nurse midwifery and nurse practitioner education that integrates the principles of diversity, equity, and inclusion. We transform healthcare by preparing ethical, compassionate, innovative, and entrepreneurial leaders to work with all people with an emphasis on rural and underserved communities. So that does reflect the longstanding history of Frontier. And I would like to also point out one of the unique things about Frontier is it really enables students to not only become very proficient in their craft, but also to develop those entrepreneurial skills. So you'll have tools not only to be well prepared in practice, but also to be prepared to start your own practice. Next slide, please. Frontier Nursing University, or FNU, is a distant learning program. It was founded to accommodate the needs of many students in rural and underserved communities, and we've been doing this very well for quite a few decades now. We have something called the culture of caring, and this is really reflected in everything that we do here at Frontier. Basically, it is treat someone else as you would like to be treated. And it takes it a step further in really caring for those that you work with and those that you will be studying with. And we use your community as a classroom. When we talk about being a community-based program, we really encourage students to provide those greatly needed services within their community. And you may study from the comfort of your own home. You will travel to beautiful Versailles, Kentucky. This is the horse racing capital of the world, I think it's fair to say. You will see barns that look like mansions and horses that probably cost more than you can possibly imagine in a lifetime. And it's quite lovely. It's very beautiful. So you will travel to our campus in Versailles, Kentucky for both a Frontier Bound that Jamie Wheeler had mentioned, or your orientation, and also you'll be traveling back just prior to your clinical experience. And I'm going to go ahead and let Dr. Scalf talk a little bit about Clinical Bound when you come back to campus.
Thank you, Dr. Phillips. So Clinical Bound is a really exciting time in our program here. At Frontier, the didactic information is front-loaded. And what I mean by that is that when you come into Frontier as a new student, You receive all of your didactic information up front. So you take all of those classes. Once that you finish the didactic work, then you come back to Kentucky at our new campus here in Versailles, and you spend about 4 to 5 days here in really an immersive experience. And what we do during that particular week is a lot of simulation. Honestly, the university has hired professional actors. We have simulation labs that are set up to really mimic what a mental health provider's office would look like. And so when you come in, you really get a lot of experience in a safe environment, assuming the role of the psychiatric mental health nurse practitioner. You get a clinic schedule, you have patients that come in. We see those patients back to back, and our actors are really good at what they do. And basically, you get to try on and really practice all of those skills that you have learned in the previous didactic work. You do all of this in a safe environment where you get feedback from your faculty, you get feedback from the standardized patients, and you get feedback from each other. One of the beauties of really being on campus together is also networking. When you come to Frontier, you're part of a community. You're just not a number, you're just not a student, but you are a part of our community. And students make relationships, they build relationships, they network, they make friendships that last long after they leave Frontier Nursing University. And so that entire week is just an immersive experience to where you can get to know your classmates. You get to practice being a psychiatric mental health nurse practitioner, and you really get that one-on-one interaction and feedback from your family, from your faculty. So we really have a good time. Students enjoy it, and then after they leave the week at Clinical Bound, they're off to start their clinical practicum and further their confidence, their knowledge, and just begin to see the end in sight. Right, the next step is graduation. So, Clinical Bound is kind of the bridge that bridges the didactic world from the clinical world.
So for those of you that are not aware of the name Dr. Hildegard Poplau, you will be learning much about her. She is considered to be the founder of the PMHNP and psychiatric nurse practitioner field. And she really brought this nurse specialty to light in 1955. I'm happy to say that PMHNPs, which is the degree program that we provide for students, which allows you to see clients across the lifespan and be very well prepared to see cradle to grave, so to speak. And then we find PMHNPs not only in all 50 states, but also there are some foreign countries that also work with PMHNPs, including Belize, and I believe there may be another Central American country that's considering that. PMHNPs may also work in New Zealand and Australia as well. Dr. Scalf, do you want to mention anything on that?
No, I think you covered it, Dr. Phillips. 1955 was a really good year. Like you said, Dr. Peplau introduced the advanced practice nursing role. And as a nurse practitioner, I think that came about a little later, maybe about 1965 or somewhere through there by Loretta Ford. And so we've really evolved over the course of time, and we have a very respected profession.
Thank you, Dr. Scow. Next slide, please. So I'm happy to say that Frontier Nursing University has a long-standing tradition in the provision of distance education, and we do that very well. We've been in existence for over 80 years, working with nursing and midwifery education. Students and alumni represent virtually every U.S. state and some territories, actually. We have more than 2,500 students currently and over 8,000 graduates. And I believe this has increased since this slide as well. So next slide, please. Want to talk just a little bit about our achievements within the program. Currently, as of 2022, our ANCC PMHNP board certification pass rate is 94%, and the national pass rate is currently 91%. FNU graduates have consistently exceeded the national average in 3 particular domains of the exam by at least 10%. Dr. Scalf, would you like to add to this?
You know, I think this is a testament to the quality of our program. We're very proud of the hard work that the faculty put into the curriculum. We love the interaction with students, and even though we are an online distance learning university, we really strive to have a personal connection with you as a student. Like I said before, you're more than just a number here at Frontier, but you're part of our community. And I think that Frontier has really figured out how to deliver distance education in a personal, rather intimate way with students. We want, as faculty, to develop relationships with you. We want to be your mentor. We want to be your model. And you know, as faculty, we develop relationships with students that last a long time as well. I still have students that reach out to me with things at long after graduation, and they talk about all of the nice things that they have done since leaving Frontier. But I think these pass rates, we've consistently been above the national average. And I think a lot of that is also a testament to our simulation program. I think that's one of Frontier's best kept secrets, so to speak. Simulation programs really help you as the student apply all of this information at the advanced practice level. Once you get into clinical, you further refine those skills, but simulation that we have added into our curriculum, even into the didactic work, I think is really a big part of our success. But the relationships that we have with students, I think, really stand out. We're proud of it.
So Dr. Scalf eloquently talked a bit about our support system for students. We have an entire department who is there to help you find clinical sites. Jamie Wheeler is part of that department and does an amazing job working with students and giving them personal one-on-one attention. We also have an entire credentialing department that will walk you through the credentialing process when you're working with a clinical site, and they will virtually handle all of the paperwork, the contracts that go back and forth. And we have several advisors and a whole team of staff and faculty that are there to support you throughout the coursework. We have several mentoring groups. I'm very happy to say within our diversity, equity, and inclusion, and we add belonging, so we call it DEIB here at Frontier. We have a number of groups offered for students. We have, for example, an LGBTQ group. We've got a group for male nurses. We've also got a group for those who have served in the military, and that's just a small array of some of the things that we offer for our students. We have many options as far as scholarships and financial aid. We have a very robust library service, including many point of care services that you can utilize for free as a student. And I mentioned a little bit about our diversity impact program. Just want to talk a little bit. We also host a very renowned diversity, equity, inclusion, and belonging conference. And if you get an opportunity to participate in this, it's a great learning opportunity. You can earn CEU credit, and it's really been a dynamic, wonderful event in the past. And we've had a lot of participation at the national level. Anything you'd like to add, Dr. Scalf? Okay, next slide, please. So in 2022, FNU awarded over $700,000 in scholarships. And I believe that this has increased. I can speak to the fact that the PMHP program recently received a federal grant for over $2 million. And a good part of the focus of that grant is to help support students while they're completing their clinical rotations. So it covers things such as housing, say if you need to travel, and it really breaks down a lot of barriers for students that do want to work in underserved communities, but maybe the financial piece to traveling to another community and finding housing and whatnot is a barrier. It does help to break down those barriers. We have many scholarships available during the spring and fall terms, and we have a variety of award cycles as well. You must have a minimum of 24 credits earned within Frontier Nursing University to qualify, and you must have a minimum of GPA of 3.25 or higher. The amounts available do vary according to scholarships, but we have well over 20 well-established scholarships here at Frontier. Next slide, please. Ms. Wheeler, would you like to speak to this?
Yes, hi everyone. So like I said, my name is Jamie and I'm one of the clinical advisors. So when you would come to orientation, which is called Frontier Bound, you will go through various sessions, and one of those sessions would be with our group, which is about your clinical sites. And so we really are here to talk you through the resources. One of our major resources here is called our community map. In fact, Frontier has over 16,000 clinical sites, which is hard to believe, but it is over 16,000. These are sites that we've had past contact with. So you're not limited to those existing sites, but you are able to scout out your own sites as well. We do group advising sessions. I just did one today, in fact, and we're also able to meet with you one-on-one because we know everyone has very different situations. You know, ultimately, it is the student's responsibility to secure those clinical sites, but our unit is here to assist you with resources, and we do keep you on track with that clinical time frame. Okay. I can answer Beth's question unless Dr. Phillips, you want to jump in. This is always a question I'm asked frequently. You know, we always hope preceptors want to give back out of the goodness of their heart. But, you know, we know there's money to be made out there too. And sometimes students do end up paying those preceptors. Now, we also have an honorarium that we make available, and that's handled through our accounting department. But Dr. Phillips, do you want to talk about some of those rotation fees that, you know, we sometimes see?
Yeah, so just want to point out, Frontier is one of the few universities that does offer a small stipend to our preceptors, just as a means of thanking them for their efforts and their time working with students. And this does help to really soften kind of the time that they spend with students and really encourages our preceptors to continue to work with our students. But we have many preceptors that do donate that honorarium to the scholarship fund. So, but there are some preceptors who do charge. These are not affiliated with Frontier Nursing University, but it has become more and more common that preceptors are charging a set amount to work with students. Unfortunately, I haven't gotten a great deal of feedback regarding those sites. Typically, what I have found on the whole is students end up utilizing those pay for preceptor sites when they're further in the game. So advanced planning is really key. The moment that you start the program, it's never too early to start looking for a clinical site. Dr. Scalf, would you like to speak to this a little bit?
Sure. So we are really proud of the recognitions that we have received as a university. Here are just a few of the prestigious awards and acknowledgments that we have received from various entities. We were the recipient of the Higher Education Excellence in Diversity Award for the year of 2023. We've also been named and recognized as one of the great colleges to work for in 2023. We were also recognized for that in 2021 and 2022 as well. We also have received an International Distance Learning Award that was presented by the United States Distance Learning Association in 2021. So Frontier, we've been doing distance education for a long time, and we are really proud of the product that we have created, and we're very confident that you will enjoy your time here at Frontier as well.
Next slide, please. So there are several different degree options that we offer here at Frontier Nursing University. First and foremost, we have our MSN or Master's of Science in Nursing degree. We also offer a postgraduate certificate for those who currently hold an advanced practice certification. We also have our Doctor of Nursing practice. We do offer a direct admission to that DNP program if you have started the MSN program. And we're also looking at some continued options as well, including maybe a dual DNP and PMHNP in the future. Here's just a little breakdown of the time frame for each of the programs. We do have a term system of 11 weeks. There are 2-week breaks in our didactic courses. In our clinical courses, we really realize how hard it is to get those clinical sites, and it's best for students to be able to have the option of continuing through those term breaks. So we do have the clinical courses as a free-flowing course versus the didactic. It takes for the MSN program, it takes approximately 2 to 3 years to complete, and the postgraduate certification program takes approximately 16 to 24 months to complete. Our DNP would be in addition to that, and that takes approximately 18 months. Next slide, please. So this breaks down some of the criteria for our MSN admissions. You must hold an RN with current active licensure, a bachelor's degree in any field, and a 3.0 cumulative GPA. You must be in good academic standing with your prior educational work and at least 1 year of nursing experience. Next slide, please. For postgraduate admissions, you must hold a nursing license and an active license to practice in any of the advanced practice fields that you see listed here. You must also hold a 3.0 cumulative GPA from the highest nursing degree that you hold. Next slide. So we've got a few deadlines here for application deadlines. The first and foremost that's coming up pretty quick now is the April 3rd deadline, and that would begin coursework in July in our summer term. And then there is the June 26th deadline, and those individuals accepted would begin coursework in October. Here are some of the application steps involved. We do offer a very easy to use online application, which includes an essay. You must also submit a resume and be sure that you work to get those transcripts in as early as possible as well. And if you do hold a bachelor's degree in some field other than a BSN or Bachelor's of Science in Nursing, you will need to submit a portfolio. And we have a very detailed explanation that helps walk you through that. And we've got several individuals who can help you with that. Our tuition currently is very affordable, and compared to many institutions nationally, it's much lower. And our fees are $712 per credit hour. Next slide, please. So currently, and I want to talk a little bit about some changes coming up based on the national guidelines. Currently, our MSN students are required to complete 700 or 675 clinical hours, and that works out to be roughly a minimum of 16 weeks of clinical experience. And for our postgraduate students, you must complete a minimum of 540 clinical hours, and it works out to be approximately a minimum of 14 weeks. As of the winter term 2025, this will be updated. About 3 years ago, our certification bodies put out some guidelines that students recommendations that students should have a minimum of 750 clinical hours. Now, this would be 750 clinical hours for both our master's program and postgraduate program. And this is not something that was established by Frontier per se. These are the national guidelines. So all schools will be transitioning to the 750 clinical hours, and that will begin as of the winter 2025 term. Our DNP program has 500 clinical hours as well, for those of you that want to do the continuation on to the DNP. Next slide, please. So very honored to introduce, we have Dr. Kevin Scalf, our department chair, AKA Fearless Leader, myself. We have a whole host of course coordinators and course faculty. We have a role that's very unique to Frontier, and that's our regional clinical faculty members. Our regional clinical faculty members really serve as a mentor and advisor to our students throughout the clinical rotations. They also complete what's called a mid-clinical site visit. And this is where they will spend approximately a half day working with you and your preceptor. And as the name denotes, it occurs when you're about halfway through the clinical courses, and really helps to guide you to really individualize your clinical experience. So for example, if there's an area as a student where you haven't gained a good deal of experience and you'd like to explore that more, that's something that you can really work with your RCF or regional clinical faculty member to focus on throughout your learning. Or if there are certain areas that you feel like you have some opportunity for growth. So it's very nice because it's very individualized in nature. We also have our fantastic academic advising and clinical advising team, and we're pleased to have Jamie Wheeler here with us today. We also have a very robust financial aid department, and I mentioned our credentialing department, and we have a number of credentialing coordinators who work in specific states. So they're very familiar with the state level Board of Nursing guidelines, and they can really help to walk you through that credentialing process. Next slide, please. This is our beautiful campus that I mentioned in Versailles, Kentucky. I am happy to say the housing is very comfortable. It was recently completely updated, and we've gotten great feedback. And I will just put out a vote that our cuisine is very good. So we have a wonderful chef on campus, and we offer a number of different varieties to accommodate dietary needs for vegetarians, vegan, food allergies. They do a wonderful job working with that. Next slide, please. So, what are your questions as a psychiatric mental health nurse practitioner?
I just want to say I'm trying to keep up with the chats, but I apologize if I missed your question. I know admissions and I are working hard here. Here's a question maybe you both can touch on. We've had some students asking about outpatient versus inpatient, and maybe you could just delve into that a little bit more.
Sure. So you have a number of, and this is all based on the national certification guidelines, a number of hours that you'll complete in your clinical courses, but also certain visit types. This degree does prepare you well to see clients across the lifespan. So you'll have, for example, 50 required pediatric visits, a number of older adult visits, and whatnot. I can assure you that all of these visits can be very easily completed in the outpatient setting. Now, certainly if you have an interest working in an inpatient setting, you may certainly do that, but all of our students have been able to complete those requirements in the outpatient setting. I noticed that we had a question about Belize, beautiful country. And yes, they do hire PMHNPs as providers, and they do have practice authority in the country of Belize. In Australia and New Zealand, you would also have that ability as well. Dr. Scalf, do you want to speak to how many students are admitted to the program per term?
Sure. So each term, we admit approximately 88 to 90 students per term. We have rolling admissions, and one of the things that I like about Frontier is every class is offered every term. And so that is really nice as well if you choose to maybe slow down a term, maybe something's going on in your life, maybe you have unexpected stress or whatever the case may be. We offer every class every term. We look at this number of accepted applicants very closely because we could go well above the 88 each term if we wanted to. However, we want to make sure that we have the faculty, the resources that we need to provide you with an individualized, personable experience with your education. When you come to Frontier, we are really invested in your education and we're dedicated to your success. And so we have really chosen that number as a way to allow a very personable connection with you as a student. So each term, it's around 88 to 90 students that we admit.
So based on the federal financial aid guidelines, I saw a question pop up recently. Students are able to take a maximum of 2 academic hiatuses in a calendar year period. So that is all, again, based on federal financial aid guidelines. And an academic hiatus would be defined as 1 11-week term. And that figure of 88 to 90 students is just within the PMHNP program. We also offer nurse midwifery. We have a women's health option as well as a family nurse practitioner option.
I can speak to the question about the curriculum and the form of the curriculum and that sort of thing as well. Like I said earlier, our curriculum is structured in a way that you receive your didactic information first. So you work through those didactic courses. Now, our didactic courses, I think for the most part are asynchronous. However, we do have some synchronous sessions that are well planned in advance. And they consist of things like group projects. We have simulation activities that happen in certain didactic courses. And we also have individual exams and papers as well. The reason that we have some of those different learning activities is because of the knowledge that you acquire while you're here at Frontier is different. Some of the things that you really master with the content could be assessed, let's say by an exam, but other things are more are really more evaluated with things like group discussions, group projects, or simulation activities. So we really have a variety of learning modalities in each one of the didactic courses. There are at least 2, if not 3 or 4 faculty members that teach in a given course, again, so that we can allow for good communication back and forth. And we want to make sure that you're able to stay engaged in the content and really be able to interact with your professors and your faculty. So our curriculum, I would say, consists, Lisa, of all of those things. Because I think at the end of the day, there are some learning modalities that are appropriate for some content and other learning modalities that work better for others.
So I saw a question regarding telehealth hours in the clinical courses. I can speak to that. Currently, students are able to, at the MSN level, complete a maximum of 405 hours via telehealth, and that's defined as any patient visit where you see the patient via video. As for our postgraduate certification students, you are allowed to complete a maximum of 500 hours via telehealth.
I also saw a question related to the synchronous coursework and what time of the day is that held, and so forth. So all of the synchronous class sessions that we hold are also recorded so that you can watch at your convenience. If there are synchronous class sessions that maybe you need to show up for, such as group work or simulation activities and that sort of thing, those are well planned in advance, and they're really offered at different times of the day, scattered over several weeks, so that you really have good time to plan. And we know that students are in different time zones, and we work with that as well. So those particular sessions are well planned out. You know about those well in advance, and really there are multiple times that you can sign up and attend some of those sessions. All of those sessions are also recorded in case you are unable to attend, the live events and the live sessions for the most part. So we do really make a concerted effort to accommodate people across the nation. We have students in all 50 states, and we really do want to make this doable for you. We understand that you also have a life, and you have other obligations. So we really want to make sure that we deliver what we can so that you can really make the most of your education. I also saw a question about therapy. I'm so glad you brought that up. And so in our curriculum, we do have a psychotherapy class, and it touches on different psychotherapeutic modalities, so that you can have an understanding of that. One of the things that I tell clinical bound students a lot is the fact that medication management is a lot of what nurse practitioners do, but at the end of the day, it's not always about the medication. Therapy really does go a long way, and I think that's important for us to embrace and understand. So yes, we do include therapy, psychotherapy classes in our curriculum.
And I noticed the question we had about a white coat ceremony. I will say that our graduation ceremony is pretty extraordinary, and we have quite a few faculty that are involved. It is typically at the Rupp Auditorium, which is a very large auditorium here in Lexington, Kentucky. We have quite a few students participate, and each year our stadium is pretty much full. Wouldn't you say, Dr. Scow? Yeah, so that speaks volumes.
Dr. Phillips, I see a question about the procedure for finding a preceptor for the clinical requirements. Can you touch a little bit on that?
Yeah, so I'll speak a little bit to that, but if you have further questions, please let me know. Again, the sooner you can try and find a preceptor, the better. There are a number of ways to reach out within your community. Networking with local advanced practice organizations is a great start. Ms. Wheeler had mentioned our community map. It's an incredibly robust map where you can actually locate a number of preceptors within your area who already have an established relationship with Frontier Nursing University. Also, I mentioned the clinical outreach grant that we have. It's the Behavioral Health Workforce Grant, Educational Grant. And under that grant, we have formed a number of clinical partnerships across the country. And these are clinical sites that have taken a number of our students over the course of the past couple of years and have agreed to take a number of our students continuously in the future. So those are also options. One thing to remember when you are looking at a clinical site, if there's one thing that psychiatry does well, it's the utilization of technology to meet the needs of underserved populations. That being said, if you find that you're working in a telehealth environment, please reach out to your regional clinical faculty member as soon as possible if you will be working outside of the state where you are licensed and reside. There may be some specific state level guidelines through the Board of Nursing that need to be fulfilled. So we want to make sure that we can take care of that for you. Do we have any other questions along those lines? Someone had asked about our Preceptor presence in Boston. It is very large. We have quite a bit of participation. Each year we do host a combined live clinical, mid-clinical site visit discussion. And that is held in Boston. It includes our FNP program, our nurse-midwifery, and women's health program, as well as the PMH&P program. And so it's a great opportunity not only to interact with individuals and clinical preceptors in the area, but also gives you an opportunity to meet some of your colleagues in the other programs as well. We have quite a few preceptors in Alaska. I can honestly say that we've got a really good national network. Particularly in Alaska, we've got a number of tribal and Indian health service sites that many of our students have worked with. And that includes some of the more rural northern areas of Alaska as well. And yes, we have preceptors in Arkansas as well. I can pretty much say if there's, you know, we've got preceptors in all of the 50 states. So you will be covered, including Hawaii. Yeah, rural Alaska has been a continual wonderful experience for our students that have engaged in that opportunity, particularly through our tribal sites. Someone had mentioned working with Indigenous populations. One thing that I do want to mention, if you would like to work with a federally funded site, such as the Veterans Administration or VA, or say a tribal clinic system or Indian Health Service, please remember that there are some extra security measures and it does take longer for those sites to be credentialed. There are a number of our VA sites that do require a longer application process. I know the VA in Albuquerque, New Mexico, asks that students apply 18 to 24 months in advance. So when I say the sooner the better to really start on your clinical search, that definitely holds true for those types of sites. Ms. Wheeler, did we have some other questions before we hand it over?
Well, somebody's asking if there are incentives to precept in certain areas. Maybe you can take that one, Dr. Phillips.
Yeah, so we've developed a whole database of incentives that are offered to our clinical preceptors. There are a number of states such as Colorado, New Mexico, and Arizona, and I believe California does this as well now, but they offer a stipend and even a tax credit, not that's a formal tax credit to really provide that support for our preceptors. And we're well aware of the process and we can really assist our clinical preceptors in applying for those funds. And there is a fund for many rural areas. The funding in New Mexico, that tax credit that I mentioned, is focused specifically on rural underserved areas of New Mexico. Do we have other questions?
It looks like there's a question about minimum clinical hours per week.
Okay, so this is going to change with the 750 hours. Currently, students are required to be in clinic a minimum of 20 hours per week in the MH 712 through 715 course. Our clinical courses currently are divided in a total of 5 courses. And so once you hit the final course, or MH 716 course, you are required to be in clinic a minimum of 30 hours per week. Now, when we transition to the new 750-hour curriculum, our students, we're going to average it out per week, but we're looking at anywhere from 24 to 25 hours per week across the board in each of the courses. And the courses will transition from the 5 courses down to 3 clinical courses of approximately 250 hours each. Anything that we missed, Ms. Wheeler?
We have Lisa asking about wanting to do like a specialty in the program. Could you touch on that a little bit more, such as eating disorders or oncology?
Yeah, that's great. And that's one of the real advantages to our program here at FNU. You do have the ability to really tailor your clinical experience to a certain extent to your interests. We have a number of students, for example, that are really interested in the treatment of eating disorders. So we do have several sites in the Denver metro area where students have been able to work with world-renowned experts in the field of eating disorder treatment, both in an ICU, all the way through an outpatient setting. Now, I would advise you to really also consider that you will want to have a good foundation of experience for the outpatient setting, including medication management, because this is most likely where you will find yourself working. So it's good to have that exposure in your clinical rotations. Any other questions, Ms. Wheeler?
I think I am getting them all. Somebody was asking what the application fee is, and I will have to refer to Richard on that. I am not sure what the application fee is.
Yes, hello, folks. I'm a little under the weather. That's why I'm not on camera, but the application fee is $50 currently.
Thank you, Richard. I'm sorry I missed you earlier. Would you like to introduce yourself?
Yes, my name's Richard Kolke. I'm a part of the admissions team. So I'm an admissions counselor, and I'm going to post some more information about the team if individuals have questions or obviously need further assistance after this Q&A session. But it's nice to be here. Thank you, folks.
So it looks like this slide is just a slide that talks about success. It talks about motivation, and it talks about the fact that success doesn't come to you, but you have to go to the success. And that's quoted by Marva Collins. I think that is so true. I think that we really do have to motivate ourselves sometimes. We have to have the ultimate goal that we want to achieve. And once you have that goal at Frontier, we're going to work with you to create a road to achieve that goal. So you have to remember, even though we have to pursue success at Frontier, you're not alone. We're here with you every step of the way.
And I would just like to add to that, when I mentioned the culture of caring, Frontier does an amazing job of really bringing people together. And students do feel very well connected through that Frontier Bound experience. I can tell you, when I graduated with my first degree from Frontier, which was my FNP certification, I am still in contact with the individuals that I went to Frontier Bound and Clinical Bound back in 2010. So we're still in contact. We still email each other. And the nice part about that is we've all kind of gone into our specific specialties. So not only can we provide support to each other on a friendship level, but on a collegial level as well.
And I would just say, we're here as a team of people, of professionals dedicated to your success. As we've talked about in this presentation, there are many people who help you along the way. We look at things through our own specialty lens, but at the end of the day, you are our priority. You are our priority, and we are invested in your success. And we have a big team of people that are accustomed to working with students on distance education programs, and we're here to help you throughout your journey.